Planks are arguably one of the most popular core exercises. And when you break it down, you can categorize it under an anti-extension exercise, right? But here's the thing. When you look at your patients and clients planking, what is the most common compensation that you typically see? It's normally extension through the lumbar spine. Well, wait a second. We just said that it's an anti-extension exercise, meaning that we don't want extension, but then all of our patients and clients are actually going into extension. Well, what's going on here? Well, to me, there's two main reasons that we tend to see extension during a plank. The first is that we've shifted our focus to the time aspect, right? We usually tell people to plank for 60 seconds, 90 seconds, 2 minutes, as long as you can. And it's great for that competitive aspect, and it gets them engaged, but it usually dramatically decreases form. So we need to start changing out of that time aspect. And the second reason that we see a lot of extensions during a plank is usually just from poor coaching, poor cueing, and poor setup. So what I want to do in this video is give you 5 tips that are directly going to help you coach, cue, and execute better plank so that when your patients and clients go into their plank, they really start feeling their abs. And sometimes they feel their abs for the first time. A lot of times people do a plank and they don't really feel their abs. They just feel a lot of tightness and stiffness and think it's their abs. Well, there's a couple of key things that we really need to ensure that our patients and clients are doing to maximize how much they recruit their abs and then ultimately how much they actually feel them. Tip number 1, stop praying during a plank. What I mean is that the go-to position for the hands and the shoulders is this praying or clasped hands position. A lot of our patients and clients are already in postures and positions that's creating too much tension through the shoulder. And the problem is when you go down into a plank and you go into that praying position, it just internally rotates the shoulders. And sometimes people set up really far and it's just not the greatest position for the shoulder. So we can fix this by simply giving them a dumbbell or a yoga block. And all we do is put it in between their hands. And then when they go into their plank position, we're in much more of a neutral position at the shoulders, which again is just going to help that patient or client not excessively feel the pressure through their shoulders when they're planking. Tip number 2, cue the head down and the chest up. Remember, we're looking to fight extension. We're trying to have our patient or client go through a plank and avoid excessive extension. Now, this is typically through the lumbar spine, but one of the hidden ways that a lot of people drive extension is through the cervical and the thoracic spine. So an easy way to do this during the plank is to have the head up and to be in more of a retracted position at the shoulder blades. This is then going to funnel down to that lumbar spine in the pelvis and then drive that typical anterior pelvic tilt and lumbar extension that we usually see during a plank. So, like I said, a lot of times patients and clients subconsciously set up in a position where the head is up. They might be looking at something, they might be talking to you, and then they ultimately retract down. All we need to do to fix this is cue head down, chest up. So all we're getting is some protraction through the elbows and the shoulder blades and the head staying down. Now, a lot of times you might have to really work with your patient or client because when they press up, a lot of them are patterned that they're also going to go into cervical extension. So again, 2 cues, head down, chest up. Tip number 3 is belly button focus. When I'm coaching a plank to a patient or client, I really want to ensure that they are hyper aware of their belly button. The belly button driving towards the ground is going to be extension. The belly button towards the ceiling is really going to help them capture that posterior pelvic tilt and that overall flexed base position that we're looking to get for this anti-extension exercise. So again, we go through all of our steps, making sure we have neutral shoulders, we make sure we have head down, chest up, and then we cue our patient or client to bring their belly button up towards the ceiling. Again, this is where patients and clients really start to feel their abs. So if we put it all together, we're going to have a neutral shoulder. We're going to go head down, chest up, and then the belly button up to the ceiling is really going to start to drive that posterior pelvic tilt. Tip number 4, use a foam roller. The foam roller is ultimately your best friend when teaching a plank to a patient or a client. Remember, to be successful at a plank, your patient or client needs to know how to properly posterior pelvic tilt. Now, if you are a physical therapist, a strength coach, a personal trainer, you know that a posterior pelvic tilt for a lot of patients and clients is not an easy task to accomplish. This is where the foam roller comes in, and the cylindrical aspect of the foam roller allows them to start to roll the pelvis. So what we're going to do is have our patient or client go onto the foam roller on their quad. Quick side note, the higher up towards the hip, the easier the exercise will be. Right above the knee, that's going to make it the most challenging. So once they're on the foam roller, we go through all of our tips that we've talked about, and then we're just getting them to gently roll the foam roller towards their chest. So it's almost like they're bringing their knees towards their chest. It looks like this. We'll go through right on that mid quad. Neutral shoulder. Again, I don't have the dumbbell with me, but dumbbell or yoga block between the hands to keep a neutral shoulder. Head down, chest up, belly button up, and then we gently bring our knees towards our chest. And you can see that's the icing on the cake for that posterior pelvic tilt. The belly button's already getting them to go into that posterior pelvic tilt direction. The foam roller rolling is really that last step that we really need. This is when your patients and clients will genuinely feel their abs. Tip number 5, don't neglect breathing. A lot of times when your patients and clients go through their plank, they do what? They hold their breath. All we need to do is cue them to inhale through their nose and exhale through their mouth. But here's the thing, the exhale should and must turn their abs on more, right? During normal respiration on the exhale, that's where we're going to get the obliques, we're going to get the abs to contract. So we want to start to bring that into our plank. So I like to cue this just as 4 breaths, probably about 20 to 30 seconds. Notice how it's not 2 to 5 minutes like the normal plank, because if they do it like this, they shouldn't really be able to plank that long. It should be challenging. So we're cueing inhale through the nose, pause, spell out pause in your head, P-A-U-S-E. Then we're going to exhale until we feel our abs. Then we're going to repeat. After our next exhale, we need to feel our abs more. So we're gradually increasing the amount of tension that is placed on our abs through our exhalation, and then we're holding on to that tension during the inhale. This is where you can start to really see some big time benefits on range of motion, on overall patterns and postures and positions when you start to couple this really good position that we've now established during a plank and now couple that breathing with it.